Parkinson's disease is an issue that could affect me, my family, or acquaintances at any time. Problems or symptoms related to the autonomic nervous system can be signs that predict the possibility of developing Parkinson's disease. I believe that understanding and managing symptoms of the autonomic nervous system can help detect Parkinson's disease early or even delay its onset. Through this video and several others, I will briefly introduce Parkinson's disease and focus on discussing the connection between the autonomic nervous system, the main topic of our channel, and Parkinson's disease. Parkinson's disease is a condition that almost everyone has heard of at least once. Parkinson's disease is the second most common degenerative brain disorder after Alzheimer's dementia. Especially for those of us living in an aging society, it is an issue that could affect not only ourselves but also our family members or acquaintances at any time. The average age of onset for Parkinson's disease is said to be around 55 years old. However, these days, the proportion of people under 50 developing Parkinson's disease is gradually increasing. Globally, the prevalence of Parkinson's disease among those aged 65 and older is reported to be about 1%. In other words, about 1 in 100 people are affected, but if we include those who actually have Parkinson's symptoms but have not been officially diagnosed, the prevalence of Parkinson's disease is estimated to reach as high as 2%. According to data from the National Health Insurance Service in Korea, as of 2020, more than 100,000 people are suffering from Parkinson's disease. I believe that among those watching this video, or among people around you, there are quite a few who are struggling with Parkinson's symptoms. Parkinson's disease refers to a condition in which dopamine-producing neurons in the substantia nigra, located in the brainstem at the center of the brain, are destroyed, resulting in particular difficulties with movement. In other words, the part of the brain responsible for Parkinson's is the substantia nigra in the brainstem, and this area is structurally and functionally closely connected to the hypothalamus in the brainstem, which can be considered the highest control center of the autonomic nervous system. In fact, it seems likely that the reason many of the various symptoms of Parkinson's disease are mediated by the autonomic nervous system is related to this connection. Moreover, an even more important and meaningful fact is that in a significant number of patients who are later diagnosed with Parkinson's disease, some autonomic nervous system symptoms appear as early as 5 to 10 years before the onset of Parkinson's itself. Therefore, understanding and managing these autonomic symptoms can help with the early detection of Parkinson's disease and may even play a role in delaying its onset. And based on the opinions of some experts and published papers, it is believed that problems or symptoms related to the autonomic nervous system could serve as signs that predict the likelihood of developing Parkinson's disease. In fact, it is clear that the mechanisms of Parkinson's disease, its symptoms, as well as the course of treatment and prognosis, are all very closely related to the autonomic nervous system. I will explain this topic in more detail later on. The main symptoms of Parkinson's disease can largely be divided into motor symptoms and non-motor symptoms. The most common motor symptom is tremor. Tremors can occur even when at rest. They usually occur more on one side of the body, and often the body is stiff or rigid. Movements become slower. This is referred to as bradykinesia. Posture also becomes stooped and unstable. These are the main motor symptoms. As for non-motor symptoms, there are various psychiatric symptoms and autonomic nervous system symptoms. Psychiatric symptoms include depression, anxiety, apathy where emotional response is lost, impulse control disorders, and hallucinations. Typical autonomic nervous system symptoms include orthostatic hypotension, gastrointestinal motility disorders or constipation, olfactory disturbances, urinary problems, and sexual dysfunction, all of which are common autonomic symptoms seen in Parkinson's disease. In addition to these non-motor symptoms, cognitive decline, chronic fatigue, and generalized pain are also commonly observed symptoms of Parkinson's disease. However, in the early stages of Parkinson's disease, when the dopaminergic neurons in the substantia nigra of the brain, the area I mentioned as the main site of pathology, are being destroyed and lost, the motor symptoms I described earlier often do not appear. In fact, because typical motor-related symptoms only become prominent after about 60 to 80% of the dopaminergic neurons have been lost, it is often difficult to detect Parkinson's disease in its early stages. On the other hand, it is important to remember that in the early stages, when dopaminergic neurons first begin to degenerate, psychiatric issues or autonomic nervous system symptoms often appear before the typical symptoms of Parkinson's disease. In other words, these non-motor symptoms can be signs or early warning symptoms of Parkinson's disease. However, just because you have these non-motor symptoms does not mean that everyone will develop Parkinson's disease a few years later. Therefore, it is not good to have excessive anxiety or fear about this. However, if these non-motor symptoms persist, it would be good to pay closer attention and carefully watch for the appearance of motor symptoms of Parkinson's disease. Parkinson's disease is difficult to diagnose by simply measuring values with specific testing equipment. A neurologist will take a detailed medical history and perform a neurological examination, considering both together. Usually, clinical diagnosis of Parkinson's disease is made by referring to various tests such as MRI, SPECT, PET, blood chemistry tests, and autonomic nervous system function tests. And when it comes to treating Parkinson's disease, the main approaches are medication, physical therapy, and surgical treatment. However, to this day, there is still no medication or treatment that can completely cure Parkinson's disease. That is why many pharmaceutical companies are currently conducting numerous clinical trials to develop new drugs for treating Parkinson's disease. In addition, research and clinical trials on stem cell and gene therapies, which are considered the medicine of the future, are also being actively conducted. Nevertheless, the reality is that there is still no definitive cure. Personally, I believe that addressing issues related to the autonomic nervous system can also make a significant contribution to finding a treatment for Parkinson's disease. I hope that by listening to the upcoming series on the relationship between the autonomic nervous system and Parkinson's disease, you will have an opportunity to better understand Parkinson's disease. Furthermore, I hope that you will gain the wisdom to respond wisely to Parkinson's disease, which could affect you or those around you at any time.